Bismillah ar-Rahman ar-Rahim, Alhamdulillah, wassalatu wassalamu ala Rasulillah. Last time we were discussing chapter number 4, and it was divided into 6 parts. We covered 3 parts, and now we'll cover the last 3 parts over here. So the fourth part talks about infectious diseases and epidemics. So generally, it's not permissible for a doctor to perform an operation or a medical procedure on a patient without their consent. And in the case the patient is unable to give consent, either being a minor or a majnoon, or maybe they're knocked out unconscious, or for whatever reason, it's impossible for them to give consent. Their wali should give the consent before a medical procedure. So that's the norm, and that is what is supposed to be followed. In some cases, however, um, you can take steps and perform that procedure and perform that treatment, even if the patient is unwilling to give consent, right? Even if the patient doesn't want to do that. Um, because treatment in those cases becomes obligatory, because if you don't do that, it's either the patient who's going to suffer death or extreme injury or pain, but they're just stubborn and they don't want to go through it, or it's one of those diseases which can actually harm other people. And we'll talk about infectious disease in a moment. And in some cases, the patient's just being stubborn and it's going to put a lot of burden on the ones taking care of them. So you can't put other people in trouble just because of some ideals that you might be holding. So if it's harming those who are taking care of the patient and nursing the patient, and it poses a burden on them, on the family, the caregivers, then in these few cases, uh, you can just bypass the consent part and go on with the medical procedure. Now, when it comes to contagious diseases, there are different hadith over there. You probably have experienced in the time of the COVID-19 this discussion taking place, and the question whether or not diseases are actually contagious. Are some diseases contagious, or is contagion just a Western myth? Well, this is actually more of a theological problem than it is a fiqh problem. Uh, the basic problem over here is that does this world run on cause and effect? Do some things cause others to happen? Yes or no? Or are there no causes at all and Allah subhanahu wa ta'ala does as He wills? That is the basic notion, and that is the principal question over here related to this masala. Well, some of the theologians they say that there's no such thing as asbab, there's no such thing as ilal. So there is no cause and effect nexus in this world, and everything that happens with the will of Allah subhanahu wa ta'ala. And so for everything, Allah subhanahu wa ta'ala, when He wills, it happens, and there's no such thing as cause. On the other hand, other theologians, and I'm talking about from the Ahl Sunnah wal Jama'ah, they suggest that Allah subhanahu wa ta'ala has set up some systems in this world. That's why we call the dunya darul asbab, that there are asbab, there are causes on which Allah subhanahu wa ta'ala has made certain effects. And so it's not that these things have effects on their own. Like these causes and these asbab, they don't intrinsically have the power to affect something, to bring about something, but it is the sunnah of Allah subhanahu wa ta'ala that He has tied some things with others. For that reason, there are some asbabs which can cause other things. and contagious diseases being one of them. So contagion itself, uh, it's not within the disease itself, but it is by design, by the sunnah of Allah subhanahu wa ta'ala, that He has placed as such. Now we'll look at the hadith. So one of the hadith mentioned in Sahih Bukhari, for example, which denies transmission and contagion of disease is, for example, لا عدوى ولا طيرة ولا حامة ولا سفر. So there is no adwa. So the Prophet ﷺ mentioned explicitly there is no such thing as contagions. On the other hand, you have a hadith mentioned in Sahih Muslim where the Prophet ﷺ instructs that لا يورد ممرز على مسح, that a diseased person should not be brought or should not come to the healthy people. I should stay away from them. In another hadith, he mentions فرك من المجذوم فرارك من الأسد. Flee from the leper as you would flee from a lion. Right? So just stay away from a contagiously diseased person. So these contradicting hadith, how do you explain them? Well, those who say that it is the sunnah of Allah subhanahu wa ta'ala to create some cause and effects in this universe, they would say for them that's easily said. That when we say la adwa, there is no contagion, what they actually mean, or the hadith actually means is no such nothing is contagion in itself. Intrinsically, nothing has the ability to transmit to another. Only by the design of Allah subhanahu wa ta'ala and by the sunnah of Allah subhanahu wa ta'ala do they have that ability. How do the first group of theologians explain this? Those who refute the idea of asbab in the first place? Well, for them, asbab don't exist, so there's no such thing as a contagion. Diseases cannot transmit from one person to another. The reason why we would take precautionary measures is because the Prophet alayhi salam has mentioned us to do so. So we're not taking precautions based on the fact that the disease will be contagious. We're taking precautions as an order all on its own. Question: why is the Prophet ﷺ then giving these orders if the diseases are not contagious, right? Well, the answer to that is a hifdul iman. Because sometimes what happens is when you see one disease transmitting, or in their language, not transmitting, when you see one disease that started with one person and now, with the will of Allah subhanahu wa ta'ala, it is happening in other people as well. One might come to the conclusion that there is transmission taking place and that this disease is contagious. And this is something munafi lil iman or naqisun lil iman. It puts a dent in a person's iman because this is equal to saying that something has a power to do uh, something all on its own without the need and will of Allah subhanahu wa ta'ala, if that makes sense. A khulasa is that it's a theological difference with no implications or not large enough of an implication on the fiqh ahkam, right? So the first group of theologians say that there's no such thing as contagion, but you still protect yourself. You still take precautionary measures for the protection of iman. The others say that you take precautionary measures because by design and by the sunnah of Allah subhanahu wa ta'ala, there are some cause and effects in place, not intrinsically, not by the things themselves, but by the creation of Allah subhanahu wa ta'ala. Allahu Akbar. So, what are some of the methods to prevent contagious diseases? And what are the hukum for that in the Sharia? So, well, you have vaccination and immunization. And the concept of vaccination is basically to take medicine and to protect yourself before a disease falls on you, before you are faced with a disease, right? So basically, a preventative measure for the disease ever taking place in the first place. Now, there's a lot of ifrat wa tafrit when it comes to vaccinations. Some are like anti-vaccine, and they are not going to take any of it, and some push vaccination for no good purpose at all, right? And vaccination, and they're not the first group has its own reasons, because the concept of vaccination is that they actually take a strand of the same disease they're protecting you from, either a dead strand or an extremely weak strand, and they insert it into your bloodstream. And when a pathogen enters the bloodstream, the body, as it's designed to be, reacts by creating antibodies for that pathogen. So when the pathogen is really weak or it's dead, it's not going to harm the body, but the body is now going to actually create the antibodies for it. So when the next time a living or an active pathogen enters your body of the same disease, let's take COVID-19 for example, the body already has antibodies for that disease present, and so it can attack and get rid of the disease as soon as it enters your body, the virus, as soon as it enters your body. That's the concept of vaccination. The problem here, or the khatar over there, is the possibility that that strand might actually make you sick. The one you inserted in the patient to actually immunize them might actually cause harm to them. So that's why one of the principles of vaccination is that that child or that person must not have been sick, must not be in a fever or recently came out of a fever. They should be in optimal health before you actually go with the process of vaccination because of that khatar and that uh, possible danger over there. But anyhow, if medically proven, and the doctors that are suggesting this are not uh, clinically biased, or let's say they're not influenced by the big pharma. You'd know them to be of good character and good faith. If they suggest that a certain vaccination should be taken, uh, then the question then would be, is it permissible to take vaccination? And would it be permissible to take medicine before the disease, before the onset of the disease, before you're actually sick, right? Well, it is permissible. And we know that because in the hadith mentioned in Sahih Muslim, the Prophet ﷺ says, من تصبح بسبع تمرات عجوة لم يزره ذلك اليوم سم أو سم ولا سحر. The one who begins his day with seven ajwa dates, then the entire day, neither poison or magic will work against them or work on them. So this hadith tells us that the Prophet Islam, he's telling us of a precautionary measure, and that at the start of the day, have seven ajwa dates, and this is going to protect you from poison and from black magic. So this hadith is giving you that preventary precautions are okay. Similarly, Aisha radiallahu anha, she mentions a hadith, an event, and this is mentioned in Sahih Bukhari, that the Prophet ﷺ, إذا آوى إلى فراشي نفث في قفيه بقل هو الله أحد وبالمعوذتين جميعا. That whenever the Prophet ﷺ went to bed, he would take both his hands, blow on them, and then recite, or he would say Surah Al-Ahad and the Mu'awwadatayn, and then blow on his hand and, you know, spread it all over his body. And when he got sick and couldn't do it by himself anymore, he would ask Aisha radiallahu anha to do it for him. And so this hadith tells you that istirqa, a ruqya, which is done to protect you from the evil eye, from the jinn, or from hawamul arz, insects and other things during the night. Even if the person is not sick, even if they're very healthy, it is permissible to do istirqa, to do ruqya, or to take preventative measures, right? And so fil jumla, it is allowed to take such measures, and this then translates into taking preventative measures against possible diseases like chickenpox, COVID, uh, or measles, for example, as well. Sometimes what happens is these vaccinations, they may result in short-term fever as well. Some people get sick when they get vaccinated. Uh, if the possible problems that arise from vaccination are lesser than the damages that would occur because of the disease itself, then go ahead and get vaccinated. But if the problems arising from vaccination are much more than what the disease would possibly bring about, and because you know that disease is not necessarily going to happen, you might as well evade it for your life if Allah subhanahu wa ta'ala wills so. So some people might be actually very allergic to certain vaccinations. It would not be permissible for them to use them. Or maybe their immune system is weak. And so you taking the risk of actually vaccinating that person is not worth it, or it won't be permissible. Because again, these diseases, even though contagious or possibly contagious, are not necessary that they will always transmit to the next person. Allahu a'lam bisawab. So, khulasa is you can vaccinate if the harms that come through vaccination are much less and not life-threatening or damaging than the negatives of it. The other way of preventing contagious diseases is al-hajr al-sihi, quarantine. And this is a very important way of containing or controlling epidemics. And one of the ways to do that is to prevent the infected people from moving place to place. And so in a hadith mentioned in Sahih Bukhari and Muslim, the Prophet Islam he mentions, إِذَا سَمِعْتُم بِالطَّاعُونِ بِأَرْضٍ فَلَا تَقْدَمُوا عَلَيْهِ وَإِذَا وَقَعَ بِأَرْضٍ وَأَنْتُمْ فِيهَا فَلَا تَخْرُجُوا فِرَارًا مِنْهُ. Then if you hear that a certain place has been affected by the plague, do not go there. And if a plague breaks out in the area you're living in, do not exit that area, right? And so, clear instructions about limiting movement or not interacting with people who are sick or if you are sick, right? The same hadith that we mentioned earlier, لا يورد ممرض على مصح, that a sick person should not be brought or should not come to the healthy people. And Umar radiallahu anhu, for example, 1300 years ago, applied the same quarantine when in Arz al-Sham there was a plague. Umar radiallahu anhu ordered the Muslimin not to flee or enter that land. And a lot of Sahaba lost their lives in their plague, but they didn't become a source of harm to other people. So whenever such a thing happens, if the Waliul Amr, the Sultan, if they actually, quarantine people in special hospitals or other places, that is permissible. Wallahu a'lam bis-sawab. That was number four. Number fifth is seeking treatment from the opposite gender. So whether it's men treating women or women treating men, In normal circumstances, this would not be permissible, especially we're talking about the treatment that would involve a kashf al-awra and al-mas. If it's if that treatment like depends on the opposite genders touching, the doctor touching the patient, or seeing their aura, for example, then in this case, in normal circumstances, it is impermissible for opposite genders to interact in medical condition, in a medical situation. Only in the case of zarura is this permissible. And the principle behind zarura is يتقدر بقدر الزرورة, that a zarura can make a haram halal, but only uh, can make a haram halal, but only to the degree that it is needed. So, for example, if you have to see one thigh, if the doctor has to see one thigh of their opposite gender patient, they can have them remove their entire pants, right? And if you have to like touch only one part of the neck, you can hold their hands or their head and move around. You just ask them to bend their neck and then touch the neck. That's pretty much it, right? So you can only touch the area or see the area you're not allowed to see, which is necessary for the treatment, else it's not permissible. Now, what are the dalil? How do we know because of this? Well, we know that Allah subhanahu wa ta'ala mentions in the Quran, Surah Al-Hajj, verse 78, أعوذ بالله من الشيطان الرجيم وما جعل عليكم في الدين من حرج. There is no haraj in the deen, in Islam. So if there's an actual need, please go ahead. Similarly, you have that qaida, الضرورات تبيح المحظورات. When there is a zarura, actual need and necessity, it makes permissible and mubah those things which are haram. Similarly, there is an ijma. You'll see it mentioned in all of the books of fiqh that it is permissible for a man to treat a woman, look at her and touch her if need be, even if it's her awra al-mughallasa, even if it's her private parts, if there is a need, then it is permissible. Now, permissible, but not without its conditions. There are actually 6 conditions that the fuqaha place for the permissibility of such treatment to take place. First of all, there should be no woman available who can treat the female patient. Or if there is a woman available, but she's not good at her job or doesn't know specific treatment necessary for that specific situation. Condition number 1. Condition number 2 is that the female patient's life should also be at risk, or that she would suffer immense amount of pain or some other technicality. If it's kind of a disease or kind of something that's not really, it just bothers you or it's slightly painful, then in this case, you are not allowed to seek medical treatment from a male. Thirdly, the male doctor must not be non-Muslim if there is a Muslim doctor available. So if you have a Muslim doctor, you can't go to a non-Muslim doctor. Only exception is the case where the non-Muslim doctor is more qualified in the sense that only he could properly conduct a certain treatment, and the Muslim doctor is unable to do so. Then in that case, it may be an exception. Fourth condition is that the doctor should be confident that there won't be any fitna. They won't be attracted to that woman sexually. So if there's a fear of lust, then it won't be permissible for him to treat her for him specifically, another male doctor available, if he feels that he is safe, then it would be permissible for him to do so. Unless, of course, it's a critical situation in which you have that one single doctor who fears that lust might take over him, that when, it's a critical condition, everything becomes permissible. Almost everything becomes permissible, and this is one of those cases. Fifth condition is that there should be a mahram in the room as well, or imra thiqa. So the doctor and his female patient should not be alone. There should be a mahram of the female patient, her father, her husband, her brother, her adult son, or another woman who's trustworthy. And the sixth condition, uh, so the previous condition was to avoid khalwa, which we know is forbidden in the hadith. As the Prophet Islam mentions, لا يخلون رجل بامرأة إلا كان الثالثهما الشيطان. That a man and a woman do not seclude, except that the third with them is the shaitan. And the sixth condition is ألا يكشف الطبيب من المرأة إلا مقدار الحاجة. That he should only uncover the part of her body that is strictly necessary. The rest must remain covered. And when he sees that part of the body, which, needs not be that needs to be seen, after that, uh, it is not allowed for him to do that. So necessity is given in consideration, but in due proportion, into whatever is actually necessary, no more than that. This was about men treating women. What about the other way around? Women treating men. The same things apply, the same rules apply. And for this, we have proof from the Sunnah as well. And so Rubayy bint Mu'awwidh radiallahu anha in a hadith mentioned in Sahih Bukhari mentions, كنا مع النبي الإسلام نسقي ونداوي الجرحى ونرد القتلى للمدينة. That in the time of Nabi al-Islam, we used to give water and treat the wounded and ship back the bodies back to Medina. Those who died, we would take their bodies back to Medina. Anas ibn Malik radiallahu anhu, he mentions about his mother and other women of the Ansar. كان رسول الله صلى الله عليه وسلم يغزو بأم سليم ونسوة من الأنصار معه إذا غزا فيسقين الماء ويذابين الجرحى. That the Prophet عليه السلام, he would be accompanied by Sulaym and other women of the Ansar. So they would give water to the soldiers and would treat the wounded. Obviously, treating the wounded would involve touching them. So in the case of need, it would be allowed for women to treat men as well. A maswan nazar. Mm. Now, an important point to note is the profession of the nurse. A lot of people, maybe not a lot of people, but some people take these hadith and use it as a justification for the profession of nursing. Not that nursing is haram in itself, but the problem occurs. Would it be allowed for a female nurse to touch and treat a male patient? And the other way around, would it be allowed for a male nurse to touch and treat a female patient? Well, obviously, if it's like a dire need that we talked about, that's already covered. But what about normal circumstances? What about just changing the bandages or, taking a blood sample and things like that? Would it be permissible? Well, the answer to that is no, because al-mas wa nazar, or this treatment, is only allowed when there's a necessity. When there's not a necessity, you have other options to do so. It wouldn't be permissible. So female nurses should tend to female patients, and male nurses should tend to male patients. It wouldn't be allowed for a nurse to do that, or for a person to have a nurse do that to them. So you can't have a non-mahram woman touching you for taking a blood sample, or non-mahram man doing that to you. And this is an area where there's a lot of tafrit. A lot of people don't actually consider this option or think about it very much. Allahu alam bisawab. So you have the sunnah suggesting that it is permissible uh, for Muslim women to treat men in cases of need, like there was in the time of war when all the men would be fighting and the other tasks would be the responsibility of the women. Allahu alam bisawab. And then you have the ijma of the ummah, where they have permitted this other gender treatment in case of need and necessity. The Islamic Fiqh Academy, Al-Majma al-Fiqh al-Islami, after reviewing this same mas'ala, uh, they issued the following rulings, you could say. That is the default ruling is that if there is a female Muslim specialist doctor, then she must treat the female patient. If you don't have a female Muslim specialist, then a female non-Muslim doctor would be given preference. If she's also not available, and no female doctors at all, then a Muslim male doctor is to be given preference. And then when he's not also available, only then would a non-Muslim male doctor be given the chance to treat the woman's body. So four stages: Muslim woman doctor, non-Muslim woman doctor, Muslim male doctor, and non-Muslim male doctor. In this tartib, in this setting, a male could treat a female and the other way around. A female could treat a male. And so in the male case, it would be male Muslim doctor, then non-Muslim male doctor, then female Muslim doctor, then non-Muslim female doctor. That is number one. Number two is, uh, uh, and also the treatment should happen in the presence of a mahram of the woman who's being treated or an other woman who is trustworthy. The treatment should also happen in a manner where utmost care should be taken not to look at the parts of the body that you're not allowed to without, like, if you're for the purpose of diagnosis and treatment, only look at those parts of the body which are absolutely necessary. The second recommendation that the Academy makes is that the health authorities should dedicate great effort to encourage women to join all tracks of the medical profession, especially obstetrics and gynecology, because these are specific to women disease and women problems. Right, so there's already a scarcity of women engaging in these medical specialties, right? So if you have a class of working women, and if you have so many doctors, they should be encouraged to take these specialist fields in order to fulfill the need of the women of the society. Allahu alam bisawab. So that was the fifth discussion. The sixth discussion is about أحكام العورة والخلوة, about the أحكام of عورة and khalwa, about privacy, seclusion, and about the عورة. First of all, what is the hukum of touching and looking at the عورة for the purpose of medical treatment? Well, the aura, as you know, it refers to the part of the body that needs to be covered during prayer, and it's the part of the body that you can expose to people other than whom it is permissible to expose it to. And it's different for men and women. For men, for example, their aura for a woman is from the navel to the knees, and a woman's aura for the man is her entire body, except obviously her face and her hands. And this is in respect to looking at. Touching for the opposite sex, if they're not your mahram or your wife or husband, is completely off the table. So, although there are some parts of the body that a woman can view of the man and the other way around, no part of their bodies can be touched without a necessity, right? So, aura, as I mentioned, for men's aura for women is from the navel to their knees, and women's aura for men is their entire body, except for their hands and their face. So the aura should be covered at all time. But in the case that the doctor needs to examine any part of the body not included in the aura, then there's no problem with that as well, right? However, within the area of the aura, even if it's the same gender, right? Even if it's the same gender, you need to be careful about what you're exposing. So for women as well, if a woman is with a woman, then their aura is that the same as that of a man, from the navel to the knees. So you can expose any area of that to another woman as well, right? What this is going to tell us that even if it's the same gender doctor that's treating you, when it comes to the aura, you're not allowed to look at it normally. So Abu Sayyid Khudri radiallahu anhu mentions, لا ينظر الرجل إلى عورة رجل ولا المرأة إلى عورة المرأة. A man should not look at the aura of the man, the woman not the aura of the woman. But when need be to see and touch the aura, then it would be permissible on the basis of necessity and severe need. And as we mentioned, يتقدر بقدر الضرورة. You can only do that to the extent that you actually need it. And we have evidences for what we're suggesting. Surah Al-Hajj verse 78, ما جعل عليكم في الدين من حرج. There is no haraj on you. The same قاعدة عامة that we've been discussing, الضرورات تبيح المحظورات. Necessities can sometimes permit even haram. But again, like I mentioned, it's not just completely permissible. There's some parameters, some conditions, some guidelines that must be followed when you are engaging in some form of previous haram or something that is normally forbidden. So, what are the things that you need to be careful of? Number one, do not exceed the area necessary for diagnosis and necessary for touch. Just that area in which you have to see the aura and you have to touch the aura. That's allowed. Nothing more than that. So Isa ibn Salam, one of the great scholars, mentions إذا وقف الطبيب على الداء فلا يحل له النظر بعد ذلك. If the tabib actually understands what the condition is, that is it. For the diagnosis point of view, you can't look more than that. The second he understands that this is the disease, the diagnosis has to stop right there and now. Similarly, if the description of the disease that the patient gives is sufficient for diagnosis, then it won't be permissible for the doctor to actually view the aura anymore either. Also, if seeing is sufficient for the diagnosis, then touching it is not permissible. And if you can actually go through the treatment by having a hile, by wearing gloves or putting a piece of cloth over that aura, you can't touch it directly either. So these are steps and stages in which you have to take care of before actually going through the medical procedure. It's necessary for the Muslim doctor to take care of, and necessary for the Muslim patient to make sure that their doctor goes through these procedures. And this is something worth pushing, especially if you're living in a non-Muslim majority country, right? You can actually push for these things to make sure that whenever you go to the hospital and you're faced with a situation, the medical staff there understands your religious needs. The last mas'ala of today is حكم الخلوة, a seclusion of the opposite genders. So what is the hukum of khalwa between doctor and his patient and doctor and the nurse? Well, we already know it's haram between a female patient and a doctor to have khalwa, or a female, whether she's a patient or she's the nurse. Because there's the mafsada is much more than the maslaha. And it is impermissible shar'an. أي لا يخلون رجل بامرأة إلا ومعه محرم. That a man should not seclude with a woman except that her zu mahram is also with her, right? And so Imam Nawawi mentions that if a stranger man, a non-mahram man, he does khalwa with a non-mahram woman with no third party around, this by the consensus of the ulama is haram, right? So the detriment that's going to result from the khalwa of a male doctor being alone with a female nurse outweighs any benefits you can possibly consider, right? Especially when you have the possibility of having a male nurse. So if that is the case, then it would not be permissible for a male doctor to be alone with a female patient or a female nurse, nor for a female doctor to be alone with a male patient or a male nurse. Allahu alam bisawab. Now, if there are any questions, I would